Bodybuilding for diabetes. Not only will bodybuilding help to prevent the onset of adult diabetes, which is one of the most prevalent diseases today, but it will also really play an important role. Here is why bodybuilding is a must. When weightlifting, the muscle tissues are primed to suck up excess glucose in the blood. Intense exercise cannot be performed unless carbohydrates are taken in at some point. You may need to monitor how many carbohydrates you eat pre or post-workout. Not only will bodybuilding help to prevent the onset of adult diabetes, which is one of the most prevalent diseases today, but it will also really play an important role in controlling it in those who are already affected. Here is why bodybuilding is a must if this disease is something you are concerned with. Decrease total body weight. One of the first reasons why weightlifting is helpful when trying to manage diabetes is because of the fact it helps to decrease the total body weight through the reduction of body fat tissue. Unlike cardio training, which has a higher tendency to reduce both fat and muscle mass, weight training really helps with the promotion of lean body mass while dieting, thus helps prevent this muscle mass loss. Since having a high body fat level is strongly correlated with the onset of diabetes, keeping this factor under control is extremely important. Increased blood glucose control. Next, bodybuilding dramatically increases your blood glucose control, as when weightlifting, the muscle tissues are primed to suck up any excess glucose in the blood. Furthermore, since carbohydrates are stored in the body as muscle glycogen, an increase in muscle mass means more storage room, reducing the chances these carbohydrates are floating around in the bloodstream or converted to body fat. Increased attitude towards food intake. The third reason why there is a strong connection between bodybuilding and diabetes is simply the mindset that those who are very involved with bodybuilding adopt. Due to the nature of their training and the desire to build muscle, they are paying very close attention to their meal frequency. Since one of the big treatment methods of those who do suffer from diabetes is eating in regular intervals to never let blood sugar levels get too low or too high, this fits right in with the bodybuilder's diet setup. More glucose storage in the body. Finally, the last big reason why bodybuilding will help with the prevention and treat diabetes is the increased glucose storage that occurs in the body as a result. Muscle tissue is the storage house for glucose in the body, and when running low, will suck it up from the bloodstream. As referred to above, this is good for keeping total blood sugars under control, especially if you eat a meal that is higher in carbohydrates. So, the more muscle you are able to build through bodybuilding, the more storage house capacity you'll have for this glucose, hence the more carbohydrates you should be able to eat without having as much of a problem. So, don't miss out on the bodybuilding diabetes connection. Exercise plays a vital role with this disease, but many people don't realize just how beneficial getting into bodybuilding can be for managing it.